today because I, as you can see by the title, am 1 week post-op VSG. Well, technically I am 1 week and 3-ish days, I guess, 3 days. I had my surgery on August 8th in Atlanta, Georgia with Dr. Hernan Urego. The reason I wanted to make this video was to kind of document my progress. Even if I'm just doing it for myself, even if nobody watches this, I just want to document my progress, list my stats, and kind of just see how all of it goes. Okay, so my stats, my heaviest weight was 381 pounds. I started a pre-op diet for 3 months and lost 50 pounds, and my weight of surgery was 331 pounds. Today, 1 week and 3 days post-op, I weigh 311 pounds. So I have lost a total of 70 pounds, but 20 pounds through the surgery. One of the things that I wanted to talk about was kind of preparing myself for this surgery. I watched a lot of YouTube videos. I did a lot of research on Instagram. I had a whole Pinterest board for the surgery. Everyone kind of made it seem like it was the easiest surgery they had ever gone through. They said they woke up and they didn't have any pain. They, you know, were back on their feet within days and just doing fine, doing perfectly. That was not the case with me. I woke up in excruciating pain. I had my surgery outpatient. I probably should have mentioned that. I went home the same exact day, 2 hours after I woke up from surgery. My husband did stay home with me for 2 days, but that's beside the point. I was in so much pain, I didn't want to go home. I wanted to stay at the hospital. So I woke up, I was in a ton of pain, just radiating across my chest, into my shoulders, into my stomach. I told the nurse that was in there, Desmond, I feel horrible, you know, my chest is hurting, my stomach's hurting, what do I do? So he gave me a little bit more morphine. I had apparently been in recovery for about 2 hours, which I did not know that. I guess I was in and out of consciousness. That makes sense, right? So yeah, I took more morphine and it didn't do anything. So he had me stand up and walk around, and I walked around for about 15 minutes, and I started to get a little bit of relief, at least from the gas pain, a lot of, you know, belching, that kind of stuff, releasing the gas, TMI, but yeah, that's just how it goes. I was up walking around. I was fine when I was walking around. The pain actually felt a lot better when I was upright instead of actually laying backwards on the recliner they had me in. So I was upright walking around, and then I started getting abdominal pain. So I would sit down for about 15 minutes, I'd stand up for about 15 minutes and walk around. I was in horrible pain. It just point blank was in horrible pain. I was so surprised. Nobody warned me for this. You know, I was upset. I had watched so many videos. I was already just in a horrible mood at this point from having this surgery, and I had only been awake for 15 minutes. So I went home. They sent me home, and I went home, and I expected to be walking around and kind of just resting, sleeping, just a lot of sleeping. I didn't sleep. I got home, I was awake, I watched TV with my husband, I was in a lot of pain. He had to, and still has to, a week post-op, help me get out of bed because of how sore my muscles are. I asked him, you know, what do you think I should do? Should I call my doctor? I'm just very, very sore. And he told me, well, your doctor told me that the reason why you're going to be so sore is because he had to clamp your muscles back. I was not aware of this. I still don't really understand. I know he had to clamp my muscles so that he could actually get to my stomach from my muscles in my abdomen. And I'm guessing that just caused a lot of bruising and scarring. I do have a massive bruise on my stomach, but not to scare anybody, of course, because 1 week and 3 days post-op, I feel 1,000 times better. I went to school today. I had 2 classes, an anatomy and a math class, and I went and I sat through both of them fine. It was a little difficult walking around campus, but sitting in class was fine. I'm fine. I drove myself there and everything. I don't take my pain medicine anymore. I have just been taking the Tylenol, the children's pain and fever. Let's see if it'll focus. Pain and fever, acetaminophen. My surgeon told me I could not take anything other than acetaminophen, so that's what I'm taking. I take 3 teaspoons a day, and it's doing fine for me. As far as my weight loss, I'm really excited about that. Other things that I didn't know were going to happen: I was constipated for 5 entire days after surgery. Did not use the restroom. The dehydration, I was pretty dehydrated at some point, and when I got home I was dehydrated, and just taking little sips of water, you know, that's all you can really do for that. And now I'm managing it a lot better. As far as vitamins go, I chewed up my multivitamin that I was told to take and immediately vomited it out. So I have now subscribed to the Patch MD patch vitamin that you can put like on your upper arm. I decided to do that instead. I think it comes monthly. It's a 30-day supply. So I decided to do that. Let's see. I have gone down an entire clothes size from my heaviest weight to my weight currently, my heaviest weight being 381 and my current weight being 311. It took me down 1 clothes size. I was a 4X, and this shirt is a 3X. My pants are a 3X, and that's very, very exciting to me. I'm looking forward to, you know, getting down to smaller sizes, obviously, but it's very exciting to go down a size when you've been the same size for years. Sleeping is hard. I used to sleep on my stomach before surgery. Of course, I can't do that now. I slept on my back for 3 days after surgery just because I was so scared to sleep on my side. I thought it was going to do something. It didn't, so I sleep on my side now, and my sleep patterns are normal. As far as eating goes, my first week, I had a lot of popsicles. I didn't want the chicken broth. They suggested I had chicken broth. I didn't want it. I bought the Unjury protein powder that is unflavored, and I put it in some chicken broth, and I was done. I couldn't eat any more chicken broth. It was disgusting to me. I didn't want it. So I just have it sitting on my counter back there somewhere. I just didn't want it. This week, I'm on full liquids. Last week was clear liquids. This week is full liquids. Next week will be soft foods, like I think it's tuna, canned chicken, excuse my cats, tuna, canned chicken, mashed potatoes and baked potatoes, and things like that. And this week I'm having a lot of creamy soups. I bought a roasted red pepper soup, which was really, really good. I'm able to eat about 2 ounces of it, and I use a baby spoon when I eat that so that it's just easier for me to eat. And it helps me slow myself down so I don't eat too much. I've been having a lot of Greek yogurt. The Yoplait Greek 100 whips. That's what I bought. It's a little high in sugar, but I'm only eating a small amount at a time. They're only 100 calories. The sugar's like 12 grams, which is pretty high, but I eat just a tiny little bit at a time, and maybe 1 time a day. So that's the only sugar I'm getting for the day, and it's I'm maybe getting 5 or 4 grams of it at the most. And that's really all I've been eating on the full liquid diet. I just have had the Greek yogurt and the creamy soup. Drinking, I drink Powerade Zero just about every day. I have one of those. Smart water for the electrolytes, so it helps combat dehydration. That is something I really, really suggest you get, is smart water, because drinking regular water is fine. It's perfectly fine, but drinking the smart water really helps combat the dehydration with all the electrolytes. It's got magnesium, sodium, potassium. It really helps. So yeah, I think that's about it for my first week post-op. If you have any questions, let me know. I'll answer back to them. I will let you guys know about next week. I will update you, and I may make a video showing just some of the things that I have that I purchased before the surgery and this week for the surgery, and just over the course of the last couple months, just showing you some things that I would suggest that you have for the surgery. So thank you very much if you watched this. I'm new to this, so like I said, give me some time. Let me work on my editing. I don't really know what to do with it, but yeah, thank you very much if you watched this. I really appreciate it, and I'll talk to you next week.